She had saved lives in war zones most doctors would never survive. She had treated blast injuries in forward operating bases with nothing but field supplies and nerve. She had carried dying soldiers out of smoke and kept them breathing long enough to matter. And in a clean, well-lit American hospital, they laughed at her. A 17-year-old girl lay motionless in room 14, her legs gone silent, her future being signed away by a man with credentials he wore like armor. Every specialist had spoken, every test had been run, the verdict was permanent. But Emily Carter stood at the foot of that bed and saw something none of them did. And that was the moment everything started burning down. If this story already has you leaning forward, stay with me. Follow along, hit like, and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. Let's go. The morning it started, Emily Carter arrived 12 minutes early, the way she always did. Not because the hospital expected it, not because anyone noticed. Old habit, the kind that gets drilled into you at 19 when late means a soldier bleeds out waiting. She'd been stateside for 3 years now, working the neurology floor at Redstone Memorial in Ashbrook, and she still couldn't shake the rhythm of deployment. Up before the alarm, coffee in a paper cup, shoes laced before she was fully awake. She was 31 years old, and she looked it in certain lights, the kind that caught the fine line at the corner of her left eye, a scar from a debris strike outside Kandahar that nobody at Redstone knew about because she had never mentioned it. There wasn't much about her army years she volunteered. People asked, sometimes. She'd give them enough to satisfy and then change the subject. The floor was already running hot when she clocked in. Charge nurse Denise Pratt was on the phone with radiology, voice tight, and the dry erase board behind the station had 3 names in red instead of the usual one. Emily scanned it, clipped her badge to her scrub pocket, and pulled the first chart without being asked. Carter. Denise lowered the phone. Holloway wants a full staff briefing at 8, mandatory. What's the case? Room 14. Cadet transferred in from Fort Calloway last night. 17-year-old, no sensation below the waist. They're calling it spinal cord injury, but imaging's been inconclusive. Denise hesitated. Her mother she's military, high rank. I don't know the details. Emily noted that and moved on. She had 20 minutes before the briefing. She used them. Room 14 was quieter than the hallway suggested it should be. The girl in the bed, Sasha Vane, according to the wristband, was awake, staring at the ceiling with the specific blankness of someone who had already been told bad news and hadn't yet figured out what to do with it. She was lean and long-limbed, athletic build visible even under the hospital gown. Her dark hair was pulled back tightly, the way you wore it when neatness was a reflex, not a choice. 17 years old, already a cadet. Emily recognized the posture even flattened out, the controlled stillness of someone trained not to show panic. In the chair beside the bed, a woman in her mid-40s, back straight, hands folded. She wore civilian clothes but carried herself like she'd never taken them off. Brigadier General Laura Vane. Emily knew the rank before she saw the ID card clipped to the lanyard on the chair, arm, because she'd seen that particular brand of controlled composure exactly twice before, both times on women who had led people through things that didn't make it into the reports. Morning. Emily kept her voice easy. I'm Emily Carter, one of the nurses on this floor. I wanted to introduce myself before the briefing. She looked at Sasha. How'd you sleep? I didn't feel my legs when I woke up, the girl said. Not complaining, just stating. I know. We're going to work on understanding exactly what's happening. General Vane looked at her directly, the kind of look that was actually an assessment. Are you assigned to her case? Not officially yet. Emily kept her expression neutral. But I'll be in the briefing. She left before she could say anything else. Dr. Nathan Holloway ran the briefing the way he ran most things, efficiently, audibly, and without leaving much air for other people to think in. He was 53, chief neurologist, and the kind of physician who had spent so long being right that he'd forgotten what the alternative felt like. He had the imaging on the display board, three scans, 2 angles, 1 diagnosis written at the top in blue marker like it was already a settled matter. Traumatic spinal cord injury T10 to T11 level. Complete motor and sensory loss below the lesion. Prognosis at this stage is consistent with permanent paralysis. He clicked the pointer against the board without looking away from the room. We'll be managing the patient for secondary complications, initiating PT consults for adaptive function, and preparing the family for long-term care planning. Emily looked at the scans. She looked at them the way she'd learned to look at things in the field, not for confirmation, but for the thing that didn't fit. She saw it. She almost didn't say anything. She knew how this floor worked. She knew how Holloway worked. She'd been a nurse here for 16 months, and the unspoken rule was clear enough that nobody had needed to write it down. You flagged concerns through channels. You didn't raise them in the middle of a department briefing in front of the attending residents and the charge staff, and the man who decided whether your quarterly review said excellent or adequate. She said something anyway. The T10 compression reading in the second scan. She kept her voice even, not aggressive. It's asymmetric. The left side signal attenuation is different from the right. That pattern, Carter. Holloway didn't turn around. The pattern isn't consistent with a standard traumatic lesion. It looks more like a localized vascular, Carter. He turned around. The room got quiet the way rooms do when someone with authority makes a decision about where the line is. You're a nurse, Holloway said. He didn't say it with heat. That was somehow worse. The absence of heat, like correcting a minor clerical error. You're not a neurologist, you're not a radiologist, you're not a physician of any variety. He tilted his head slightly. What you are is late to understanding what your role in this briefing is. Someone near the back of the room shifted. Emily didn't look away. I've seen this presentation before, she said. Not here. In the field. There's a specific, you've seen it in the field. He said it back to her like she'd claimed something ridiculous. You've seen neurological spinal cord presentations in, what was it, a combat zone with field equipment? A pause. The imaging has been reviewed by myself and 2 consulting radiologists. The diagnosis has been confirmed. What you're doing right now is wasting time that belongs to a patient. He turned back to the board. That will be all for this briefing. Dr. Marsh, I'd like the PT referral initiated by noon. Emily stood still for a moment. Around her, the room was already moving. Clipboards coming off laps, conversations picking up, the small machinery of a medical floor resuming. Nobody made eye contact with her. Not quite. She gathered her things and left. She pulled Sasha's full intake file during her lunch break, which she ate standing at the supply station because sitting felt like accepting something she hadn't agreed to accept. The file was thorough. That wasn't the problem. The problem was what was in it and what the problem was being constructed around. The mechanism of injury was listed as a fall during a training exercise, a significant drop, impact to the lower back, immediate loss of sensation. Textbook framework for what Holloway had diagnosed. But Emily knew something about falls in training exercises. She'd overseen enough of them, treated enough of the aftermath, that she'd built a kind of internal catalog she couldn't have put into words, but could feel when something pressed against the edges of it. The asymmetric attenuation on that second scan. In her third deployment, an 18-year-old private named Dennis had taken a concussive blast that threw him 8 feet sideways into a concrete barrier. He'd presented with full lower body paralysis, and 2 senior medics had called it spinal cord damage. Emily had been the one to notice the uneven pressure differential in his extremity responses, a very specific thing, hard to see unless you were looking for it. And the field surgeon had caught what it actually was, a rare neurological shutdown syndrome caused by acute vascular compression, not structural cord damage, not paralysis. A different thing entirely that looked exactly like paralysis until you knew how to look. Dennis had walked out of the medevac transport on his own feet 6 weeks later. She sat with that for a long moment. Then she went back to room 14. General Vane was alone with her daughter. Sasha was asleep or close to it. The general looked up when Emily came in, and something in the woman's face said she hadn't slept either. Emily closed the door. I need to talk to you, Emily said quietly. Not as Sasha's assigned nurse. I'm not technically on her case yet. Then what are you? Someone who's seen this before? Emily pulled the chair from the corner and sat down so they were level, not hovering, not performing clinical authority she didn't have. I did 3 tours with the Army, combat nurse, forward operating assignments. I treated blast injuries, pressure injuries, neurological trauma and conditions that would not have impressed anyone in that briefing room today. Vane didn't say anything. She was listening the way soldiers listen, taking it in before responding. The imaging on Sasha's scans has a pattern I recognize, Emily continued. It's not a standard spinal cord lesion. The signal attenuation on the left side of the T10 is different from the right in a way that, in my experience, suggests acute vascular compression rather than structural cord damage. If I'm right, that means the current diagnosis is wrong, and that matters because the treatment pathway for those two things is not the same. Dr. Holloway reviewed the scans. I know. So did 2 radiologists. And you think they're all wrong? Emily met her eyes. I think they haven't seen what I've seen. I think that matters. Vane was quiet for a long moment. She looked at her daughter's still face. When she looked back at Emily, something had shifted, not to trust exactly, but to something adjacent. What would you need to do? She said. I need to request a specific extremity response assessment. There's a protocol. It's not standard civilian procedure. It's derived from military field triage for neurogenic shock. I'd need your permission, and I'd need to do it now before the PT consult gets filed and everyone assumes the trajectory is set. Does Holloway know you're here? No. Another pause. If you're wrong. If I'm wrong, nothing changes. If I'm right. Emily stopped herself from finishing the sentence. She didn't want to make it about the stakes. The stakes were already obvious. I need your permission. General Laura Vane looked at her daughter for 5 seconds. Then she said, Do it. The assessment took 11 minutes. Emily had done it faster in the field, with worse equipment and worse conditions, but those circumstances had also meant no one was watching through a window in the door. She worked methodically, testing response patterns the way she'd been trained to, not the standard reflex tests that the neurology team had already run, but a specific sequential pressure protocol developed for battlefield neurogenic evaluation that looked, to anyone watching, like a nurse doing something she probably wasn't supposed to be doing without a physician's order. Halfway through the 4th sequence, Sasha Vane's left foot moved. Not a spasm, not an involuntary tick, a directional response, the muscle firing in the exact pattern it would fire if the pathway wasn't severed. Emily went very still. Sasha. She kept her voice level. Did you feel that? The girl's eyes opened. I felt... Her face shifted. That hurt. Good. Emily exhaled. That is genuinely good. She was reaching for her pen to document when the door opened. Holloway was in the hallway. His expression had already made a decision before he'd finished looking at the scene. What the hell is happening in here? It wasn't a question. The patient has peripheral response in the lower left extremity, Emily said. She kept the chart in her hands, kept her voice measured. I performed a modified neurogenic response assessment and you performed. He stepped into the room. Behind him, 2 members of the floor staff. On a patient not assigned to you, without a physician order, without authorization. Each word had the same flat weight, using a protocol that is not part of this hospital's approved care framework. The protocol is recognized in military medicine. The response is real. Her legs aren't, get out of this room. Dr. Holloway, if you review what just happened, security. He said it to the hallway without raising his voice. I need security to room 14. General Vane stood up. Doctor, with respect, General Vane, your daughter is a patient in a civilian medical facility, and this nurse has conducted an unauthorized intervention on a vulnerable minor. He hadn't moved his eyes from Emily. You are done here. You will come with security, you will surrender your badge, and you will not return to this floor. Emily looked at Sasha. The girl was sitting up. Her left foot had moved. Her expression was the complicated mixture of pain and something that might, in a few hours, resolve into hope, if anyone gave it the chance. Emily set the chart down on the bed table. Document her left lower extremity response, she said. Whatever else happens, put that in the record. 2 security officers appeared in the doorway. They were doing their jobs. She didn't make it difficult for them. She walked out of room 14 with both officers at her side and Holloway's voice behind her in the hallway, already on his phone, already constructing the version of this story that ended with her badge on his desk and her career in pieces. She could hear the shape of it. She'd heard similar shapes before, in different languages, in places that smelled like smoke instead of antiseptic. What she hadn't heard yet was the sound of tires on the hospital's front drive. She wouldn't hear that until she was already in the security office with her badge in a plastic bin and a form in front of her that said, in clinical language, that she had been relieved of her duties pending a full review. She was signing the bottom of it, not because she was giving up, but because fighting in the wrong room was a waste. When someone knocked on the security office door. "Dr. Kelso?" The guard who opened it looked puzzled. There are military vehicles out front, like actual military vehicles, and personnel. They're asking for hospital administration. Dr. Kelso, the administrator on duty, looked up from his desk with the expression of a man whose afternoon had just become unrecognizable. Emily stopped writing. She looked at the door. And for the first time since the briefing that morning, something that was not quite a plan, but was very close to one settled into place behind her eyes. She set the pen down on the form. "I think," she said quietly, to no one in particular, "you're going to want me in that conversation." Nobody answered her. Dr. Kelso was already on his feet, already reaching for his jacket with the reflexive dignity of an administrator who'd learned that military presence at a front entrance was the kind of thing you met with your jacket on. The security guards looked at each other. Emily stayed where she was. "Ms. Carter." Kelso's voice carried the particular neutrality of someone managing a situation they didn't yet understand. "You're still in the process of, I know what I'm in the process of." She nodded at the form on his desk. "But whatever's happening out front, it's connected to room 14. And if you walk into that conversation without me, you're going to be missing context you can't afford to be missing." Kelso looked at her for a moment, the kind of look that was really an equation being solved. He picked up his jacket. "You walk behind me," he said. "You don't speak first." She didn't argue. The lobby of Redstone Memorial was not a large space, which made the 4 people standing in it feel like more than 4 people. 2 of them were in uniform, Army service uniforms, not fatigues, which meant this wasn't a physical response. It was a formal one. The third was a man in his 50s in civilian clothes with the bearing of someone who had not always worn them. The fourth was a woman Emily didn't recognize, younger, carrying a document case and not looking at anything casually. The taller of the uniformed officers turned when Kelso came through the door. Colonel's insignia. He had the kind of face that had probably been patient for a long time and was close to running out. "Dr. Kelso?" Not a question. He'd done his homework on the way over. "Colonel Vance Drayden, Army Medical Command. We're here under emergency review authority regarding a patient currently admitted to your facility." He handed Kelso a document without ceremony. "Cadet Sasha Vane, admitted last night, currently under neurology care." Kelso took the document. Emily watched his eyes move across it. She'd seen his expression cycle through 3 different calculations in the span of 4 seconds. "General Vane contacted our command at 0900 this morning," Drayden continued. "She reported concern that her daughter's diagnosis may represent a significant medical error, and she requested formal Army Medical Command review under the protocol that applies when active duty family members are involved in cases of potential clinical negligence." "We have a full neurology team on the case," Kelso said, and Emily could hear him trying to find stable ground. "Dr. Holloway is our chief neurologist. I'm aware of Dr. Holloway's position." Drayden said it without effect. "I'd like to review the imaging and the case file before we have any further conversation about the medical team." He glanced past Kelso and found Emily without apparent effort, the way people trained to read rooms found the relevant detail. "Are you Emily Carter?" She hadn't expected that. "Yes." "General Vane mentioned you specifically." He looked at her badge, still in the plastic bin, she realized, which she was still holding. "Is there a reason you're not wearing that?" Kelso cleared his throat. "Ms. Carter was in the process of... There was an incident this morning involving unauthorized patient contact." "What kind of contact?" Emily answered before Kelso could. "I performed a modified neurogenic response assessment on Cadet Vane, without a physician's order. She had peripheral motor response in the lower left extremity following the protocol." Drayden was quiet for exactly 2 seconds. What protocol specifically? It's a battlefield neurogenic evaluation sequence, developed for triage in cases of suspected vascular compression mimicking spinal cord injury. I used it in the field, forward operating assignments, 3 tours. The response pattern I got from the cadet is not consistent with a complete spinal cord lesion. The man in civilian clothes, who had not moved or spoken since Emily came in, shifted his weight slightly. She noticed. Dr. Marcus Fell, he said, introducing himself without waiting for Kelso to manage it. Army trauma surgery, retired, now consulting for medical command. He looked at Drayden briefly, then back at Emily. Where did you do your Army nursing? 6-8W, later cross-trained. Fort Drum, then 2 rotations in Kandahar, 1 in Djibouti. Under which command in Kandahar? 3rd Brigade Combat Team, 10th Mountain. Fell and Drayden exchanged a glance that carried information Emily wasn't meant to read but did anyway. Something had just been confirmed. We'd like to see the scans, Fell said. Getting them into the imaging suite required Kelso to make 2 phone calls, the second of which was clearly to someone above him. Emily stood in the hallway outside the suite and waited, still holding her badge in the bin. One of the uniformed officers, not Drayden, the quieter one, stood a few feet away and didn't try to make conversation. She appreciated that. Holloway arrived 7 minutes later. She heard him before she saw him, the particular cadence of someone who had received information they considered an insult and was moving toward the source of it. He came around the corner with 2 residents trailing him like a wake, already speaking before he'd found who he was speaking to. I don't know what's been reported to your command, he said, addressing Drayden with the authority of a man who'd never had a room not respond to it. But I want to be very clear that what occurred this morning was an unauthorized intervention by a nursing staff member who has already been dismissed from this facility. Dr. Holloway. Drayden's voice didn't rise. We'll get to the incident. Right now I'd like your case notes and the imaging pulled up, and I'd like Dr. Fell to have 5 minutes with the scans. Dr. Fell is not on staff at this hospital. No, he's not. Drayden's expression didn't change. He's here under the authority of Army Medical Command and the protocol document you were provided downstairs, so I'd like those scans, please. A beat. Holloway's jaw moved slightly, the way jaws do when someone is deciding whether the next word is worth it. He pulled up the scans. The imaging suite was small, with the display board taking up most of one wall. Fell put on his glasses and stood in front of it with his hands behind his back and didn't say anything for almost 3 minutes. The residents didn't know where to look. Kelso checked his phone and put it away. Holloway stood with his arms crossed, and Emily knew the posture. It was the posture of someone who was performing confidence because actual confidence had started to feel less certain. Emily looked at the scans again from where she stood near the door. The second scan, Fell said finally. He pointed, not touching the screen. The asymmetric attenuation on the T10 left lateral. Was this flagged in the radiology review? The radiologist confirmed the lesion was consistent with. Was this specific asymmetry flagged? Holloway hesitated a half-second too long. The overall presentation was assessed as consistent with traumatic spinal cord injury at that level, yes. Fell turned around. Not to Holloway, to Emily. What was her response in the lower left when you ran the sequence? Clear directional, L4 distribution, approximately 4 seconds after the 3rd application point. Her verbal report was pain, not absence. Fell looked back at the scan. Something in his posture had gone very still, the way stillness happens when someone is being careful about what they say next. This isn't a cord injury, so, he said. The room did something that wasn't quite silence because there were too many people breathing. The compression pattern on the left T10 is vascular, Fell continued, clinical and flat. This is acute neurogenic shutdown secondary to localized vascular impingement. The cord is intact, the pathway is intact. She's not paralyzed. She's in physiological shutdown, and it is reversible. He turned to look at Holloway directly, and there was nothing hostile in it, which was somehow more difficult to receive than hostility. How long has she been in this state? Holloway didn't answer immediately. She was transferred from Fort Calloway 14 hours ago, Drayden said. Fell exhaled through his nose. 14 hours in a shutdown state without intervention. He didn't editorialize. He didn't need to. The quieter uniformed officer near the door had taken out a notepad at some point Emily hadn't tracked and was writing. Holloway found his voice. The imaging was reviewed by 2 qualified radiologists. The diagnosis was wrong, Bell said, and the nurse who flagged it this morning made the correct call. Emily heard it. She let it sit for a moment before she let herself feel anything about it, because the room wasn't done yet. Holloway turned toward her, and for a second she thought he was going to say something that would make all of this worse. His face had the look of a man who'd built his entire self-concept on a foundation that was showing its first crack, and the specific danger of that look was that it could go several directions, almost none of them good. "You had no authorization," he started. "She had the patient's mother's authorization," General Vane said from the doorway. Nobody had heard her come in. She was still in civilian clothes, but she was carrying herself differently than she had been in the room with Sasha. No longer a worried mother waiting, but the rank underneath that, the one that had been there the whole time. "I gave Nurse Carter my explicit permission to perform that assessment," Vane said. She looked at Drayden. "I want my daughter receiving treatment for the actual diagnosis within the hour." "We'll get a protocol started immediately," Fell said. He was already reaching for his phone. Holloway said, "This is my department and my patient." "No," Vane said. Not loud, the kind of not loud that carried further than shouting. "She is my daughter, and your department spent 14 hours treating her for something she doesn't have." The treatment began in room 14 40 minutes later. Emily wasn't officially part of it. She was still technically dismissed. Badge in a bin, form half-signed on Kelso's desk. Status in that particular institutional limbo where someone has been fired, but the situation has moved faster than the paperwork. Drayden had not told her she could stay. He had also not told her to leave, which she chose to interpret as permission. She stood in the hallway outside room 14 and watched through the window as Fell and his team worked. The protocol they were running was one she recognized. She'd seen a version of it twice, in the field, under very different circumstances. It involved precise, localized application and monitoring, and it looked quiet from the outside in the way that things that are actually working often did. 22 minutes in, Sasha Vane bent her right knee. Emily saw it from the hallway. She saw General Vane see it. She watched the woman's face do something it clearly hadn't done in the past 14 hours, and she looked away because some moments weren't meant to be observed. Down the hall, Holloway was on his phone. He'd been on his phone since Vane had spoken in the imaging suite. The 2 residents who'd followed him in earlier had dispersed. The charge nurse, Denise, had been doing the thing experienced nurses do when institutional authority is in flux, staying visible, staying useful, making no sudden moves. She stopped next to Emily. "You okay?" Denise asked. "I don't know yet. Bell's team is good." "Yeah." Emily watched the room. "She's going to be okay." Denise was quiet for a moment. "Holloway filed an incident report against you. Unauthorized procedure, potential patient endangerment." "I know." "He's also talking about pressing it further. He used the word criminal." Emily nodded. She'd expected something in that range. "He's scared," she said. Not sympathetically, just accurately. Scared people with authority were a particular kind of problem. She'd seen that too, in different contexts, with higher immediate stakes. The dynamic wasn't new. What was new was the sound of footsteps coming from the stairwell, moving fast, and the way Drayden's second officer appeared from around the corner at almost the same moment. Not running, but moving with the direction of someone who'd just received information. The officer reached Drayden, who had been standing near the nursing station reviewing something on a tablet. A brief exchange, low voices. Drayden's expression shifted in a way Emily recognized as the controlled version of something urgent. He looked up, found her again. "Carter," he walked toward her with the document case woman at his side. "We have a situation." "What kind?" "Holloway's attorney contacted the hospital's legal team 12 minutes ago. They're filing an emergency injunction to halt the military treatment protocol and remove our team from this facility on the grounds that we're operating outside our jurisdictional authority." Drayden kept his voice low and even. They're claiming the treatment currently being administered to Cadet Vane is unauthorized and potentially harmful, and they're requesting that the patient be transferred back to civilian neurology care immediately. Emily looked through the window at room 14, at Sasha, who had bent her knee 20 minutes ago for the first time in over 14 hours. If they stop the protocol now, she loses the progress, Drayden confirmed. The window for the vascular intervention is narrow. If the treatment is interrupted at this stage, the compression may stabilize at its current state. We could be looking at permanent impairment. Emily absorbed that. How long do you have? Injunction hearing is in 2 hours. Hospital's general counsel is deciding right now whether to comply with the halt pending the hearing. Down the hall, behind a closed door, Holloway was still on his phone. And somewhere in a law office in Ashbrook, someone was building a document designed to stop what was happening in room 14. Not because it was wrong, but because stopping it served someone who needed the original diagnosis to have been right. Emily looked at Drayden. What do you need from me? He held out the document case. We need your formal statement documenting exactly what you observed in those scans, the protocol you used, the patient's response, and your clinical basis from your Army service. He paused. And I need you to understand that when this goes in front of a judge in 2 hours, Holloway's team is going to argue that a dismissed nurse with a grudge fabricated a response to discredit a veteran physician. She took the document case. Then I better write a very good statement, she said. She turned toward the small conference room at the end of the hall, sat down, opened the case, and began writing. And for the first time all day, her hands were completely steady. The statement took her 41 minutes. She wrote it the way she'd written incident reports in the field. No decoration, no advocacy, just sequence and observation. What she saw in the scan, what the asymmetry indicated based on her training and field experience, the specific protocol she'd used, its origin, its documented success rate in the 3 cases she'd personally witnessed, the exact words Sasha had used when she felt pain, the time, the limb, the distribution pattern. She didn't write anything about Holloway. She didn't editorialize about the diagnosis or the briefing or the way he'd looked at her in front of the whole department. Any competent attorney would tell her that the statement lived or died on clinical specificity, and anything personal would become the thing they pulled on in a courtroom to unravel everything else. When she finished, she read it back once, changed 2 words, and brought it to Drayden. He read it standing up, the way people read things when they don't have time to sit. His expression didn't change much, but at the end he looked up and said, "This is good," in the tone of someone who knew what good looked like and wasn't being generous. Is it enough? I don't know. Depends on the judge. He passed it to the woman with the document case. Lieutenant Arden, Emily had learned, who handled Medical Command's legal interface. We've got Fell's clinical assessment and the new imaging reads. Your statement gives us the timeline and the observational basis. He paused. Holloway's team is arguing that the military protocol itself is experimental and unvetted in civilian contexts. It's not experimental. It's derived from field medicine, but the underlying physiology is the same. There are published case studies. There's a 2019 paper out of the Army Medical Research Institute that documents 12 cases of this specific syndrome. Can you cite it specifically? Landover and Singh, 2019, Journal of Military Trauma Medicine. Volume 14, I think issue 3. The syndrome is called Acute Neurogenic Vascular Compression Syndrome, NVCS. She paused. Holloway may not have recognized it because it's predominantly documented in blast injury and high-impact trauma contexts. Civilian neurology doesn't see it often. Drayden looked at her with the particular quality of attention that meant he was revising his assessment of something. Write that down, he said to Arden. All of it. Emily sat back down and wrote it down. The conference room had a window that faced the parking structure, which meant she could see the news van that arrived at 11:47 without anyone needing to tell her about it. Local station, satellite dish on the roof, a reporter she didn't recognize doing a sound check in the cold outside the entrance. Someone had made a call. She didn't know if it was Holloway's attorney, creating public pressure to counter the military presence, or someone else entirely. Either way, the story was no longer contained inside the building. Denise appeared in the conference room doorway. Kelso's losing his mind, she said without preamble. The board chair is on site. They called an emergency meeting 30 minutes ago. What are they deciding? Whether to comply with the halt. Legal is saying the injunction request has enough standing to require them to suspend the military protocol pending the hearing. Denise's jaw was tight. Fell is refusing to stop treatment. Emily stood up. On what basis? He's citing imminent harm. Says if the protocol is interrupted at this phase, the window closes. He's putting it in writing that compliance with the halt order constitutes a direct medical threat to the patient. Denise shook her head. Kelso is in there with the board and legal and Holloway, and it's not a good room, Emily. Where's General Vane? Still in room 14. She hasn't left. Emily picked up her jacket from the chair back. She hadn't been invited to the board meeting. She hadn't been invited to anything, technically. She was still a dismissed employee who'd signed the first half of a termination form. Which conference room? Emily, which one? Denise looked at her for a moment. B2, end of the admin corridor. She heard the meeting before she reached the door. Not words. Volume. The specific acoustic texture of an argument that had passed the stage where anyone was listening and entered the stage where everyone was waiting for their next turn to speak. She knocked twice and opened the door. 7 people in the room. Kelso at the head of the table, the board chair, a woman named Hartley, silver-haired, the kind of compose that came from decades of institutional crisis management, to his left. 2 people who were clearly legal, another who was clearly not. Holloway at the far end, seated, and his attorney standing beside him like a physical argument. And Drayden, against the wall, arms crossed, who looked at Emily when she came in and did not tell her to leave. Ms. Carter. Hartley's voice was not hostile, but it was precise. You've been relieved of your duties pending. I know, I'm not here as an employee. Emily came to the near end of the table and set the statement down. I'm here because the decision this room makes in the next few minutes has a direct clinical consequence for a 17-year-old patient, and I have information that's relevant to that decision. We have your statement, one of the legal staff said. It's been reviewed. Have you reviewed the Landover Singh paper, 2019 Journal of Military Trauma Medicine, Volume 14? It's the primary documented clinical basis for ANVCS diagnosis and treatment. It includes 12 confirmed cases, treatment outcomes, and the specific protocol Dr. Fell is currently using. She looked at Hartley directly. If this hospital complies with the halt order and the treatment window closes, and Sasha Vane's condition becomes permanent as a result, that paper will be the first thing a plaintiff's attorney puts in front of a jury. The room went quiet in a specific way. Holloway's attorney moved. That's a highly speculative. It's not speculation. It's a documented treatment window. Dr. Fell put it in writing this morning. If you've received that document, you know the window. Emily kept her voice level. She wasn't performing calm. She actually was calm, the way she got calm when the situation was genuinely serious. The adrenaline converting itself into focus instead of noise. Complying with the halt doesn't protect this hospital. It exposes it. The board chair looked at legal. Legal looked at each other. One of them leaned to the other and said something Emily couldn't hear. Holloway spoke. This nurse, he started, and something in his voice had changed from the morning, a quality that hadn't been there before that Emily recognized as the sound a person made when they were talking from a position they could feel weakening, has conducted herself in complete violation of this hospital's protocols. Whatever she observed, whatever she claims, Dr. Fell confirmed the diagnosis, Drayden said from the wall. He said it quietly. That's not the nurse's claim. That's an Army trauma surgeon's clinical finding. A pause. The injunction hearing is at 2 o'clock, Hartley said. She was looking at the table, not at anyone specifically. If we send representation with the clinical counter-argument, there isn't time to prepare adequate representation in legal started. I can prepare it, Arden said from the doorway behind Emily. Emily hadn't heard her arrive. I've been doing it since we got here. We have Fell's assessment, Carter's statement, the imaging comparison, and the published literature. I can be in front of a judge in 2 hours with that package. Hartley looked at Kelso. Kelso looked at Holloway, and it was the look of someone doing a calculation that Holloway didn't like the direction of. If we allow the military team to continue, Holloway said, and now the flatness in his voice was different, the flatness of someone trying to hold a shape that was losing structural integrity. We are implicitly conceding that our diagnosis was incorrect. The liability implications of that, the liability implications of a preventable permanent injury to a minor are larger, Arden said. Nobody argued with that, not out loud. The protocol continues, Hartley said. She looked at Drayden. You have our cooperation. Then to legal, get someone to that hearing. Then to Holloway, and her voice didn't change register in a way that made it somehow worse. Nathan, I'd like you to be available for a separate conversation at 3 o'clock. Holloway stood up and left the room. His attorney followed. Emily watched them go and thought about what it looked like when something started coming apart. Not explosively, but by degree, each piece quietly disconnecting from the next. She went back to the hallway outside room 14 because she didn't know where else to be. The protocol was still running. Through the window, she could see Fell at the bedside, monitoring, adjusting. One of his team members was logging something on a tablet. Sasha was awake, lying still, staring at the ceiling in the same way she'd been when Emily first came in that morning. But not the same exactly. The blankness had a different quality now, less resignation, more waiting. General Vane was in the chair, and she wasn't looking at her daughter. She was looking at the door. When her eyes found Emily through the glass, she held them there for a moment, then gave a single small nod. Emily nodded back. She sat down on the bench in the hallway, the one meant for family members on difficult days, and realized she hadn't eaten anything since the paper cup of coffee at 6 a.m. Her body had the particular hollow feeling of prolonged adrenaline. Not exhaustion, not yet, but the sense of having been running on reserves for long enough that the invoice was building. Denise came by with a granola bar and didn't say anything. Emily took it. She was halfway through it when her phone buzzed. Unknown number, local area code. She almost didn't answer. Carter? A pause. Then, this is Dr. Holloway? She stopped chewing. I want to talk, he said. Not through legal. Not officially. Another pause. I'd like 10 minutes. She processed that. The call itself was information. People who were confident in their position didn't call the person they'd fired to ask for 10 minutes. Where? She said. The rooftop terrace, visitor's exit, 1 floor up. She put the rest of the granola bar in her pocket, stood up, and took the stairs. The rooftop terrace at Redstone Memorial existed primarily for oncology families who needed air. It had 4 benches, 2 planters that hadn't been updated recently, and a view of the Ashbrook Industrial District that nobody had designed for the view. Holloway was at the far bench when she came through the door, and he looked like a man who had aged about 4 years since the morning briefing. He didn't look up immediately. When he did, what she saw in his face wasn't what she'd expected. Not anger, not the restrained condescension he'd used like a tool all day. Something flatter. Something close to a man who'd looked at something clearly for the first time in a while and hadn't liked what he saw. Sit down, he said. Then, as if he'd heard himself, please. She sat. I want to understand something, he said. The protocol you used this morning, the assessment. Where did you learn it specifically? She hadn't expected that either. Field training. We had a surgeon by Dr. Olatunji, who'd developed it from modified battlefield triage. He trained the nursing staff because in FOB conditions there wasn't always a physician available. And you'd seen the syndrome before. Once confirmed, before Sasha. One suspected case I wasn't sure about. Holloway was quiet for a moment. The radiologist who reviewed the scans, they're both board certified, both experienced. Neither of them flagged the asymmetric attenuation. He said it like he was trying to determine something, not like he was defending them. I didn't flag it. A NVCS isn't in standard civilian training. There's no diagnostic requirement to look for it because civilian neurology doesn't see the specific injury pattern that triggers it. It comes from blast pressure and high-impact velocity trauma. You'd need exposure to that context to know what you're looking at. But you knew. I'd seen it before, that's all. Holloway looked out at the industrial skyline. His hands were on his knees and they weren't entirely steady. I'm not going to pretend the way I spoke to you this morning was professional, he said. That's not... He stopped. I'm not good at... He stopped again. Emily waited. I've been chief neurologist at this hospital for 11 years, he said finally. I've had maybe 3 cases in that time that I look back on and wonder if I got them right. This morning felt like a direct attack on my clinical judgment, and I responded to it like, I responded badly. He exhaled. That doesn't change what I said. I know that. No, Emily agreed. It doesn't. The injunction is Mercer's doing. His attorney's name, apparently. I didn't ask him to file it. He's doing what attorneys do, which is protect the client, regardless of whether the client asked for that specific protection. His jaw tightened. I found out 20 minutes ago. I told him to withdraw it. Emily looked at him directly. You withdrew the injunction? I called him and told him to withdraw it. Whether he does in the next 90 minutes? Holloway looked down at his hands. I can't guarantee he does, but I've instructed him to. The wind on the rooftop was cold. Emily sat with that for a moment. Why are you telling me this? She asked. Because if he doesn't withdraw it and it gets to the hearing, someone in that courtroom is going to need to explain what actually happened today. And you'll be more effective at explaining it if you know the injunction was withdrawn by me, not defeated by you. He stood up. I'm not asking for anything. I'm giving you information you can use. He walked toward the door. Dr. Holloway. He stopped. She chose her next words carefully. Why did you ignore the asymmetric attenuation in the second scan? A long pause. I didn't ignore it, he said. I saw it and decided it was within the normal variance for the impact mechanism. He didn't turn around. I decided it too quickly. I was running 3 cases and a department meeting and He stopped again. I was wrong. I decided too quickly and I was wrong. He went inside. Emily sat on the bench for 90 seconds, alone on the rooftop with the cold air and the industrial view. Then she went back downstairs. The injunction hearing was at 2 o'clock. Arden left for the courthouse at 12:45 with a document package that Emily had helped compile, adding 2 handwritten annotations about the Landover Singh paper that she thought would read better from a clinical voice than a legal one. At 1:15, Fell came out of room 14. Emily was back on the hallway bench. She stood up when she saw his expression, because his expression was the controlled version of something significant. She's moving both feet, he said. Emily sat back down. Not because her legs gave out, but because sometimes you needed to stop being upright for a second. Consistently? On command. Ankle dorsiflexion on both sides. I want another hour on the protocol before I make any declarations, but the vascular response is exactly what the treatment should produce. He said it quietly, like it was something he was still taking in himself. You were right about the presentation. You were exactly right. I was lucky I'd seen it before. Don't do that, he said, not unkindly. Luck doesn't know to look for asymmetric attenuation on a second scan. That was training, and that was observation, and those are things you chose to develop. He paused. You're going to get your badge back. I know. He went back into room 14. Down the hall, the charge station was running normally. Denise directing the floor, vitals being checked, the usual machinery of a hospital that hadn't stopped because one case was tearing open at the seams. Emily watched it and thought about the gap between what institutions looked like from the outside and what they actually were. Not monolithic, not unified, just a collection of people doing their separate jobs while something either went right or wrong in the space between them. Her phone buzzed again. Arden. She answered. The injunction was withdrawn, Arden said. Holloway's attorney filed the withdrawal at 1:03. We're clear. Emily breathed out. How's the patient? Moving both feet. A pause on Arden's end that carried something that wasn't quite professional neutrality. I'll let Colonel Drayden know. There's going to be a formal review process, Holloway's diagnosis, the incident this morning, the timeline of events. That's going to take a few days to structure. I understand. Carter. A beat. You should know that the formal review is going to look at everything, including the hospital's employment action against you this morning. I figured. Drayden is recommending that your dismissal be suspended pending review, which in practical terms means I know what it means. She hung up and looked at the hallway. 3 years at Redstone Memorial, 16 months on this floor. She'd done her job every day in the way she'd been trained to do it. Not perfectly, not without the occasional argument with a physician who outranked her, not without the specific kind of frustration that came from knowing something was wrong and not having the standing to act on it. She told herself that was the cost of operating within a system, that the system had value even when its friction cost something. This morning had cost something real. If she'd walked out of that briefing and kept her head down, Sasha Vane would be 6 hours deeper into an incorrect treatment pathway, and by now the window might have already closed. She thought about that. She thought about Dennis, the private from the FOB in Kandahar, walking out of the medevac transport on his own feet. She thought about how none of it was clean. Not the diagnosis she'd made in the field, not the one she'd flagged this morning. She'd been working on incomplete information and a pattern match, and the willingness to say something when saying something was the harder option. It could have gone wrong. The response in Sasha's foot could have been a spasm, not a pathway. She could have been wrong, and she'd known that when she sat across from General Vane and made her case. She'd said something anyway. That was the only part of the day she was confident about. The rest of it was just what happened as a result. The door to room 14 opened. General Vane stepped into the hallway. She looked at Emily with the focused quiet of someone who had just come through a long tunnel and was still adjusting to the light. "She's asking for you," she said. Emily stood up. She followed the general through the door, past Fell's monitoring equipment, to the bed where Sasha Vane was propped up at an angle, the first time she'd been upright all day. The girl's face had the specific exhaustion of someone who'd been through something physically real, pale, drawn, eyes that had been doing a lot of work, but underneath that, visible and definite. Something that hadn't been there that morning. Sasha looked at her and said, "I felt it when you did the test, the first time." "I know. I didn't say anything because I wasn't sure it was real. It hurt, and I didn't know if hurting was bad." She paused. "Is hurting good?" "In this case, yes. Hurting means the pathway is open." Sasha nodded slowly. She looked down at her feet under the thin blanket. "Dr. Fell says I'll need rehab. Weeks, maybe longer." "Yeah, that's right. But I'll walk." Emily met her eyes. "That's what the data says." Sasha was quiet for a moment. "Thank you," she said. Not performed, not ceremonial, just the flat, direct version of it that carried more weight than the elaborate kind. "You're welcome," Emily said, and meant it. She left before it could turn into anything more. Some things didn't need to be extended. She was back in the hallway, thinking about nothing in particular. The granola bar still in her pocket, the form on Kelso's desk, the specific kind of tired that wasn't tired, but something that came after a very long sprint, when her phone buzzed. Not a call, a text. Arden's number. Review board convening tomorrow 0900. Holloway's employment status being assessed concurrently. You'll receive formal notification within the hour, but wanted you to have early word. Board chair has requested your presence. Not as the subject, as a witness. Emily looked at the message. Read it twice. A witness. Not the problem to be adjudicated, the person who would explain what had happened. She put the phone in her pocket. Down the corridor, through the small window in the stairwell door, she could see the parking structure. The news van was still there, and beside it, she had to look twice to be certain, was a second one. She stood very still. Someone had told the story, or enough of it. 2 cameras outside a hospital meant the room had already gotten smaller, that whatever happened tomorrow morning wouldn't be contained to a conference room with 7 people and a legal team. It would be the version of events that got documented, that went into records, that became the shape of how the day was understood. She thought about Holloway on the rooftop, his hands not entirely steady. I decided too quickly. She thought about Sasha asking if hurting was good. She thought about what Drayden had said about Holloway's team arguing she was a dismissed nurse with a grudge, and how she'd written a statement so clean that the grudge never showed up in it once. The problem with the news vans wasn't the exposure. The problem was that she didn't know yet which version of the story they had, and as she stood there in the hallway working through that question, her phone rang again. Unknown number. Different area code this time. Not local. She answered. "Emily Carter." A woman's voice, professional, careful. My name is Dr. Sandra Osei. I'm calling from the Army Medical Research Institute. I'd like to talk to you about the case at Redstone Memorial. A pause. And about something we've been tracking in 6 other civilian hospitals over the past 18 months that I think you need to know about. The hallway felt very quiet. What kind of something? Emily said. Misdiagnosed ANVCS cases, Osei said. All presenting as permanent spinal cord injury. All in patients with military connection. Another pause. Cadet Vane is the only one who got a correct diagnosis. Emily's hand tightened on the phone. How many? She asked. The answer Dr. Osei gave her was a number that made the rest of the day look like a prelude. 6. That was the number Dr. Osei gave her. 6 other patients across 6 different civilian hospitals, all presenting with lower body paralysis following high-impact training incidents, all with military family connection, all diagnosed as permanent spinal cord injury, all currently in long-term adaptive care programs. None of them had been assessed for ANVCS. Emily stood in the hallway for a moment after the call ended and did the math that she didn't want to do. 6 patients, assuming even a fraction of them were actual ANVCS cases rather than genuine cord injuries, assuming even 2 of them were. That was 2 people currently living inside a wrong diagnosis. 2 people who'd been told their legs were gone, who'd built new frameworks around that information, who'd grieved and adjusted and started the long process of constructing a life inside a verdict that might not be accurate. She put the phone in her pocket and went to find Drayden. He was in the small conference room she'd used to write her statement, door open, on his own phone. He looked up when she came in, and she could tell from his face that Osei had already called him too. Or someone had. The information was moving faster than she was. Sit down, he said. Not the administrative version of it from earlier in the day, just the human one. She sat. You talked to Osei, he said. Just now, 6 cases. We've been tracking it for 4 months. The Institute flagged the pattern in a routine data review. Clustering of permanent paralysis diagnoses in military-adjacent patients presenting at civilian facilities within a specific injury mechanism profile. He set his phone face down on the table. The problem was we couldn't confirm ANVCS without clinical access to the patients, and we didn't have grounds to request review at 6 different hospitals without a confirmed case to anchor the investigation. Emily looked at him. Sasha. Sasha is the anchor. He said it carefully, the way you said something that was both true and uncomfortable. Her case gives us the confirmed diagnosis, the documented presentation, the treatment record. It establishes the syndrome's presence in a civilian hospital context and gives the Institute grounds to formally request review of the other 6. How many of those 6 are actually ANVCS? We don't know yet. Could be 1. Could be all of them. We won't know until we get access to their imaging and run proper assessments. He paused. That's going to take time and cooperation from 6 different hospital administrations, and some of those hospitals are going to push back on the implication. The implication being that their neurology departments made the same mistake Holloway made. Yes. Emily thought about that. About 6 radiology suites and 6 briefing rooms, and 6 moments where someone had looked at a scan and made a decision. About whether any of those 6 moments had had a person in the room who'd seen something different and stayed quiet. What do you need from me? She asked. She seemed to be asking that a lot today. Tomorrow's review board is going to be broader than Arden told you. The scope expanded an hour ago. It's not just Holloway's employment action and your dismissal. It's the full case record, the treatment timeline, and the ANVCS pattern. Army Medical Command is co-convening with the hospital board. Drayden picked up his phone again, then set it back down. You'll be asked about your field experience in detail, the training lineage of the protocol, the specific indicators you identified in the scan. We need it on record, not just for this case, but for the 6. I understand. It's also going to be public record. The review board minutes are filed with the State Medical Board and the Army Medical Command Joint Oversight Office. Once it's filed, it's accessible. Meaning the news van's downstairs. Meaning this stops being a hospital's internal matter. She'd known that since the second van appeared. She'd known it since Osei called. She sat with it for a moment, the specific gravity of a thing becoming larger than the room it started in. "Holloway," she said, "does he know about the 6 cases?" "His attorney was notified 30 minutes ago." Drayden's voice was neutral. "As of the injunction withdrawal, he's cooperating with the review process. What that looks like in practice, he left it incomplete." "He called me," Emily said, "before the hearing, on the rooftop." Drayden's expression shifted slightly. "What did he say?" "That he saw the asymmetry in the second scan and decided it was within normal variance. That he decided too quickly." She paused. "He didn't ask me not to say anything about it." "No?" "He gave me information. I think he knew I'd use it." Drayden was quiet for a moment. "That's either a man trying to get ahead of something or a man who knows the difference between a mistake and a cover-up, and is trying to make sure everyone else knows it too." "Maybe both," Emily said. He looked at her. "Does it change anything for you?" She thought about it honestly. About the briefing room that morning, the flat dismissal, "You're a nurse," the way the room had gotten quiet and nobody had made eye contact. About 16 months of deciding which hills were worth standing on and which ones to walk past. "It changes how I talk about him tomorrow," she said. "It doesn't change what happened." Chet. She left the hospital at 6:47 p.m. Not because she was done, there wasn't a clean version of done available, but because Fell had looked at her around 6 and said, with the authority of a physician making a clinical assessment about a non-patient, "You need to eat something real and sleep for at least 5 hours or you're going to be useless tomorrow." And she hadn't been able to argue with the logic. The news vans were still outside. She went out the side entrance, through the parking structure, and walked 2 blocks to a diner she'd been to twice before. Unremarkable food, adequate coffee, booths with high backs that created the illusion of privacy. She ordered eggs and toast and sat with her phone face up on the table because she was expecting Arden to send the formal review notification, and she didn't want to miss it. What she got instead, at 7:12, was a text from a number she didn't have saved. "This is Marcus Fell. Don't be alarmed that I have your number." Drayden gave it. "I've been doing this work for 22 years, and I want you to know that what you did today was not a small thing. I've seen nurses with more experience and more institutional standing stay quiet in that situation. The review tomorrow is going to be uncomfortable. You'll get through it." She stared at the text for a moment. Then she typed back, "How's she doing?" His reply came in under a minute. Both feet on command, consistent. She asked her mother if she'd be able to run again. "I told her, probably." Laura Vane cried for about 45 seconds and then stopped and apologized for crying, which is the most military response to good news I've encountered in recent memory. Emily put the phone face down and ate her eggs. What? The review board convened at 9 the next morning in the hospital's main conference facility, which was larger than any of the rooms the previous day's conversations had taken place in. That felt intentional. The table had 14 seats, and all of them were filled. Board Chair Hartley, Kelso, 2 members of the hospital's medical executive committee, Drayden, Fell, Arden, 2 representatives from the state medical board who had arrived that morning without announcement, a woman from Army Medical Command's Oversight Division named Colonel Ewan, and Holloway, who sat at the far end of the table with no attorney beside him, which Emily noted. She sat where Arden directed her, midway down the table, with a copy of a written statement in front of her and a legal pad she didn't end up using. Hartley opened the session with the procedural framing, scope, timeline, parties involved, and then turned it over to Ewan, which itself was information about where the center of gravity had moved since the morning before. Ewan was compact, precise, the kind of person who'd distilled 20 years of bureaucratic navigation into an economy of language. She ran through the case timeline without editorializing. Transfer, admission, initial assessment, diagnosis, Emily's flagging of the imaging asymmetry, the briefing room response, the unauthorized assessment, the firing, the military response, the treatment, the injunction, the withdrawal, Sasha's motor recovery. Then she said, "Dr. Holloway, I'd like to give you the opportunity to speak to the diagnostic decision before we proceed to the formal record." Holloway had been looking at the table. He looked up. He was not the same version of himself from the morning briefing. The credentials as armor quality was gone. replaced by something that was harder to read because it was more human. The look of someone who had spent the night in a room with themselves and come out the other side with something they needed to say. The diagnosis was wrong, he said. Not qualified, not contextualized, just stated. I reviewed the imaging and I identified the T10 compression as consistent with traumatic cord injury. The asymmetric attenuation on the left lateral in the second scan was visible, and I assessed it as within normal variance for the injury mechanism. That assessment was incorrect. A pause. Nurse Carter identified the same feature and reached a different conclusion based on field experience I don't have. She was right. I was wrong. The room was quiet. My response to her in the briefing was unprofessional, he continued. I dismissed her clinical observation based on her role rather than its merit. That's a failure of process and a failure of judgment, and they're both mine. Ewan wrote something. The state medical board representatives exchanged a glance that Emily couldn't fully interpret, but which didn't look adversarial. Thank you, Ewan said simply. Ms. Carter. Emily walked through it the same way she'd written it. Clinical, sequential, no performance. The scan, the asymmetry, the protocol, its origin, its basis. The response in Sasha's foot, the subsequent confirmation by Fell. She spoke for 11 minutes and took 4 questions, all technical, all from Fell or Ewan. When she finished, Hartley said, "Is there anything you want to add that isn't in the written record?" Emily thought for a moment. A NVCS isn't in civilian neurology training frameworks, she said. That's not a criticism of any individual physician. It's a gap in the knowledge transfer between military and civilian medicine. The syndrome exists, it's documented, and it presents in a way that's diagnostically indistinguishable from permanent cord injury without specific awareness of the differential. She paused. If the 6 cases Dr. Osei is reviewing include confirmed ANVCS presentations, that gap has cost people more than 1 day in a hospital. It's cost them the life they should have had. Nobody interrupted. I'm not saying that to indict this institution or Dr. Holloway specifically. I'm saying it because the review board's conclusions are going into a record that people will read. And the most useful thing that record can say isn't who made a mistake. It's what the mistake was made of, so it doesn't get made again. Hartley held her eyes for a moment. Thank you, Ms. Carter. The board recessed at 11:40 and reconvened at 1:15. In the 2 hours between, Emily sat in the family waiting area near the neurology floor because it was the least official space she could find, and she needed to be somewhere that wasn't a conference room. She'd texted her sister at some point during the morning. She had a sister, older, in Portland, who knew Emily did hospital nursing and had approximately no framework for what the last 24 hours looked like, but who had sent back 3 question marks and then a voice memo that Emily listened to with one earphone, in which mostly said, "Are you okay? Call me," in the particular key of someone who was worried but didn't want to overstep. She typed back, "I'm okay. Going to be a long day. I'll call tonight." Then she closed her eyes for 12 minutes, which was not sleep but was adjacent to it. Denise found her at 12:50. "2 things," Denise said, dropping into the chair beside her. 1. Sasha did 20 minutes of initial PT this morning. The therapist said she has meaningful strength in both lower extremities, and her prognosis is better than we hoped, direct quote. She paused to let that land. 2. There are reporters in the lobby, not just the local stations, someone from a national medical trade publication and a wire service stringer. The story's out. What version? Army overturns civilian misdiagnosis. Military nurse saves teen cadet. Denise tilted her head slightly. Not wrong, technically. Not the full picture either. They're not usually the same thing. Denise looked at her. Holloway's office has been cleared out, not by him, by Kelso's direction. His access card was suspended this morning pending the board outcome. She said it carefully. I'm not sure if anyone told you. No one told me. I think it happened during the recess. Emily absorbed that. The speed of institutional consequence, when it finally moved, was its own kind of shock after the slowness of everything before it. Yesterday morning, he'd been the chief neurologist with the pointer and the blue marker. Today his access card was suspended and his office was empty. She thought about him on the rooftop. I decided too quickly. She didn't feel satisfied by his fall, exactly. There was something complicated in the space where satisfaction was supposed to be. Some awareness that the line between his situation and any other physician's on any other day was thinner than the outcome made it look. The outcome had been Sasha. If Sasha had been a different patient, in a different room, with a different nurse in the hallway, the diagnosis would still have been wrong, but nobody would know. That was the part that stayed with her. She went back to the conference room at 1:50 Hachut. The board's findings took 40 minutes to present. Ewan read them with the same economy she'd used all morning. Emily's dismissal was formally reversed, effective immediately, with a notation that the employment action had been taken without adequate review of the clinical basis for her intervention. Her personnel file would reflect the reversal without the original action. Clean slate, Arden had said, which wasn't quite right because nothing was actually clean, but it was the institutional version of acknowledgement. Holloway's findings were more complex and took longer. The board found that his diagnostic error was not the result of negligence in the legal sense. He had followed standard protocols, and the syndrome he'd missed was genuinely outside civilian training norms. That part of the finding was deliberately worded, Emily thought, for the liability architecture. But the board also found that his response to Emily's flag in the briefing room constituted a failure of professional conduct, that his dismissal of a clinical observation on the basis of role rather than merit fell below the standard expected of a department chief, and that this failure had directly extended the time Sasha Vane spent in an incorrect treatment pathway. His position as chief neurologist was terminated, effective immediately. He could continue practicing at Redstone Memorial in a non-supervisory capacity, pending a separate review by the state medical board of his conduct in the briefing room and his decision-making timeline. That review would be public record. "Dr. Holloway," Hartley said at the end, "is there anything you want to say for the record?" He looked down the table toward the window. Outside, it was overcast. The industrial view that Emily had stared at from the rooftop the day before was gray and flat under the cloud cover. "I hope she walks well," he said. Nobody asked him to clarify. Everyone knew who he meant. Indeed, the story broke nationally at 3:17 p.m., which Emily knew because Arden sent her a link and a 3-word text. Brace for contact. She didn't read the article. She went to room 14 instead. Sasha was in a different position than she'd been in any prior visit, sitting up fully, legs over the side of the bed, feet flat on the floor. Not standing, not walking, but the geometry of her was different. The relationship between her body and gravity restored to something it hadn't been 24 hours ago. The physical therapist was a young man named Torres who was logging something and looked up when Emily came in. 5 more minutes, Torres said. She gets tired faster than she thinks she does. I'm not tired, Sasha said. You're going to be tired in 5 minutes. That's different from being tired now. Emily stood in the doorway and watched this exchange with something she didn't have a clean word for. Not quite joy, not quite relief, but something that occupied the same general territory. General Vane was in the chair again. She'd changed clothes, which meant she'd gone home at some point and come back. She looked at Emily with the expression of someone who had made a decision about something. Sit down, she said. Emily sat. They were quiet for a moment. Torres finished his notes, told Sasha to call if anything changed, and left. Sasha was looking at her feet with the focused attention of someone doing an experiment on something that had stopped working and was learning to trust it again. The review board findings are public, Vane said. It wasn't a question. Yes. And the 6 cases. OC's team is requesting imaging access to the other hospitals, probably 2 to 3 weeks before they have confirmed numbers. Vane's jaw worked slightly. Emily had watched this woman be composed under conditions that most people would have fractured under, and she recognized the sign. The jaw was the thing that moved when everything else was locked down. How many of those 6 have families who've been told the same thing we were told? Vane asked. We don't know yet. How many of them have been in adaptive care programs for months? We don't know. Adjusting, rebuilding, making peace with... She stopped. We don't know, Emily said again quietly. But Ose's team is good, and the confirmation at Redstone gives them standing they didn't have before. They'll move fast. Sasha's voice came from the bed. Mom. Vane looked at her daughter. I'm okay, Sasha said. Not performance, just statement. The flat, direct version of it. The same register she used for everything. I'm going to be okay. Vane looked at her for a long moment. Then she looked back at Emily. Thank you, she said. I don't have a better version of that. You don't need one, Emily said. She left before she could be thanked again, because the gratitude was real, and it was also, somehow, the hardest part of the day to absorb. Harder than the briefing room and the security office and the rooftop. She could function inside conflict. She was less sure what to do with people being genuinely grateful. She was walking toward the nursing station, thinking about whether to check in with Denise about the shift schedule. She was reinstated but hadn't been formally assigned back, and the administrative mechanics of that were unclear when her phone buzzed with a call from Arden. The state medical board called, Arden said. They're opening a parallel investigation into the diagnostic timeline. Not just the conduct issue, the actual medical decision-making. They're looking at whether Holloway's pattern of rapid dismissal in ambiguous cases extends to prior patients. Emily stopped walking. Prior patients, she said. His tenure is 11 years. The board wants to review any case in the last 5 years where he signed off on a permanent paralysis diagnosis following high-impact injury. A pause. That's potentially a significant number of cases. How many? They don't know yet. They've requested the files. Emily, Arden's voice shifted slightly. If there are cases in his history where he applied the same pattern, asymmetric imaging features, rapid confirmation, dismissal of ambiguous indicators, and ANVCS was the actual diagnosis, then Sasha wasn't the first. Sasha may have been the first to have someone in the room who caught it. The hallway was ordinary around her. A cart went by. Someone laughed at the nursing station. The machinery of the floor, running the same way it always ran. Emily thought about 11 years. About how many briefing rooms and how many mornings. About how a pattern of decided too quickly accumulated across a decade without anyone seeing it as a pattern rather than a series of unconnected moments. When does the file review start? She asked. Tomorrow. The board is assigning an independent reviewer. A beat. They've asked if you'd be willing to consult on any cases where ANVCS is a potential differential. Unpaid, advisory. They know you're not a physician, but your field experience is relevant to how they interpret the imaging characteristics. She should have been tired. She'd had approximately 12 minutes of not quite sleep, a plate of eggs, and one granola bar in the last 36 hours, and the specific flavor of exhaustion that came from sustained high-stakes functioning was starting to make itself felt in her shoulders and behind her eyes. Yes, she said. Tell them yes. She hung up. She stood in the hallway for a moment and looked at the wall, which was the institutional cream color of walls everywhere in hospitals everywhere, which someone had presumably decided was calming and which mostly just looked like a wall. Then she went to find Denise and sort out the shift schedule. At 4:45, she was reviewing updated vitals at the station when the elevator doors opened and a man she didn't recognize walked out onto the floor. He was in his 40s, civilian clothes, the kind that were slightly too pressed for someone who'd come straight from an office. He had a lanyard with a visitor's badge, and he was looking at his phone, then at room numbers, then at his phone again, in the way of someone following directions to a specific place. He found her before she'd finished the thought that he looked familiar in the way news anchors and moderately visible public figures looked familiar. Emily Carter? He offered his hand. David Pressman, Ashbrook Tribune. I was hoping for a few minutes. I'm working, she said. I understand. He paused. We're going to run the story regardless. I wanted to give you the chance to be in it on your own terms. She looked at him. What version do you have? Army nurse gets fired for flagging wrong diagnosis. Military overrides civilian hospital. Teen cadet walks. He paused. We're also tracking the 6 cases, and we have a source inside Medical Command who's confirmed the pattern review. She thought about what Drayden had said. This stops being a hospital's internal matter. She thought about 6 families who'd been told a diagnosis that might not be accurate, and whether knowing the story was public made it more or less likely that those families would be reached in time to make a difference. "I'll give you 15 minutes, she said. "Official statement only, nothing off the record." "That's fine." She looked at Denise, who nodded once, "I've got the floor," and led the reporter to the small conference room at the end of the hall. She gave him the clinical version, what she'd seen, what she'd done, why. She didn't talk about the briefing room, and she didn't talk about Holloway beyond confirming the board's public findings. She talked about ANVCS, its characteristics, its basis in battlefield medicine, the training gap. She said the name Landover Singh twice and spelled it out because if it ended up in print and people searched it, the science was there to find. He took notes with a stylus on a tablet, which felt slightly too neat for a reporter in a story like this, but she didn't comment. At the end of the 15 minutes, he said, "Is there anything you want people to understand that isn't in the official record?" She thought about it. "The official record is accurate," she said. "I don't have a version that's more true than what the board documented." She paused. "If there's anything I want people to understand, it's that the reason this case went the way it did isn't because I did something exceptional. It's because I'd seen the same thing before and I said something about it. Most nurses with my background would have done the same. But most nurses didn't. Most nurses weren't in that room." She walked him back to the elevator and returned to the station. At 5:15, her phone rang. Osei, this time calling from a number Emily had saved. "We got preliminary imaging access to 2 of the 6 cases," Osei said without preamble. "Different hospitals, different states. I've been looking at them for the last 2 hours. "And?" Osei was quiet for exactly 1 second. "Both of them have the asymmetric T-level attenuation pattern." Emily closed her eyes briefly. "Both of them," she said. "Both of them. I can't confirm without clinical assessment, but the imaging characteristics are. They're not subtle, Emily. They look exactly like Sasha's pre-treatment scans." A pause. "We have 2 people in long-term adaptive care programs who may have been managing a treatable condition for. One of them has been in the program for 14 months. 14 months. "What happens now?" Emily asked, though she already knew the answer. "Now we go get them," Osei said. "And I need you to help me explain what we're looking for to the clinical teams at both hospitals. Because I can show them the imaging, but the assessment protocol, the modified sequence you ran yesterday, that has to come from someone who's done it." Emily looked at the nursing station, the floor, the doors to the rooms. The ordinary machinery of the place she'd come to work 3 years ago, and which had now, in the span of a day and a half, become the edge of something considerably larger. "Send me the files," she said. She was looking at her phone when Denise appeared at the end of the hall, moving at a pace that was controlled but deliberate. The pace of someone carrying news. "Emily," Denise stopped. Her expression was carefully arranged. "Holloway just turned in his hospital ID. He's gone." She paused. "But that's not—" "What?" "His attorney just filed something with the state medical board." Denise held out her phone, showing a screenshot of what looked like a legal notification. "Not a defense, a disclosure." She watched Emily read it. "He disclosed 3 prior cases, from his own record. 3 cases in the last 7 years where he signed off on permanent paralysis diagnoses that he now believes warrant reinvestigation." Emily read the document twice. 3 cases. Self-reported. Holloway had gone home, or wherever he'd gone after the board meeting, and instead of calling Mercer to build a wall around himself, he had listed 3 names and handed them to the state medical board. She gave Denise's phone back. "That's 5 total," she said. "Osei's 2 and his 3, plus whatever the other 4 hospitals have." "Yes." Emily stood in the hallway with that number, with the weight of it, with the specific quality of what it felt like when something you thought was a room turned out to have more rooms behind it. "Get me a conference room," she said, "and whatever the hospital has for a secure video connection. I'm going to be on a call with Osei tonight, and tomorrow I need to be at both of those hospitals before their clinical teams start their morning rounds." Denise looked at her. "You were reinstated 6 hours ago." "I know. You haven't slept." "I'll sleep on the way." She looked at the nursing station, at the floor she'd worked for 16 months, at the door to room 14, where Sasha Vane had bent her knee for the first time in 14 hours and asked if hurting was good. "Book it, please." Denise pulled out her phone. Emily walked back toward the conference room and was almost there when she heard Fell's voice behind her calling her name. She turned. He was standing at the elevator bank with his jacket on and his document case, clearly about to leave for the day. But something in his face had stopped him from getting in the elevator. "OC called you," he said. "Yes." He looked at her for a moment. "I'm coming with you tomorrow," he said. "To the hospitals. You're going to need a physician to authorize the assessments. You're retired." "I'm a consulting physician for Army Medical Command, which means I have credentials in any facility under command jurisdiction, and—" he checked something on his phone. "Both hospitals have active duty family patients, which puts them under partial jurisdiction." He put his phone away. "I'm coming." She thought about arguing and decided it would waste time she didn't have. 7 a.m., she said. "Don't be late." "I've never been late for anything in my life," he said, which was probably true in a way that said something specific about his life. She went into the conference room, opened OC's files on her laptop, and began reading. The first case was a 22-year-old man named Tobias Ruark, diagnosed 18 months ago at a civilian hospital in a different state, family member of a deployed Army logistics officer. Lower body paralysis following a vehicle accident during reserve training. Current status: adaptive care, permanent diagnosis. No reassessment since initial evaluation. His imaging was on the screen. She looked at the second scan. T11 this time, not T10, but the attenuation pattern on the left lateral, asymmetric, different from the right in a way that was exactly the same kind of different she'd seen in Sasha's scan, was there, sitting in the imaging data where it had been sitting for 18 months, unread. She set the file down and looked at the ceiling for a moment. Then she picked up her phone, called OC back, and got to work. OC's voice on the phone was the kind of calm that came from people who'd learned to keep it when things stopped being calm around them. "Walk me through what you're seeing on Ruark's second scan," she said. Emily had the imaging open on her laptop, the conference room door closed, the overhead fluorescents doing their indifferent work above her. "Left lateral T11. The attenuation differential is maybe 30% less pronounced than Sasha's was, but the pattern is the same shape. Asymmetric drop-off, not bilateral. If this were a true cord lesion at this level, you'd expect more uniform signal loss across both sides." "That's what I see too." A pause. "He's been in adaptive care for 14 months. His family was told 6 months ago that his prognosis was finalized. They've been making decisions around that." Emily didn't say anything for a moment. "Housing modifications," Ose continued, and her voice was careful in the way of someone describing damage precisely because imprecision would make it worse. "He deferred his degree program. His unit, he was reserve, not active, submitted his separation paperwork 4 months ago because he indicated he would not be able to return." Emily looked at the scan. 22 years old. A whole architecture of a life rebuilt around a verdict that was sitting right there on her screen looking wrong. "What's the clinical access situation at his hospital?" "I spoke with their chief of neurology 40 minutes ago, Dr. Priya Nambiar. She's not defensive. She pulled the file herself after I described the pattern, and she's been quiet ever since, which I think means she's looking at it." Ose paused. "She asked if we could be there by 10 tomorrow. Bell and I will be there by 9:30. Emily," a different quality in Ose's voice. "He doesn't know yet. Ruark. His family doesn't know we're reviewing the case. We're not going to tell them until we have a confirmed clinical assessment." "I know. Because if we're wrong—" "I know," Emily said again. She did know. She'd been on the other end of hope that turned out to be wrong, in different contexts and with different consequences. And she knew exactly what it cost. "We run the assessment first. We're certain before we say anything." "Right," Ose exhaled. "The second case? Female patient, 26, Daphne Okafor, different hospital, same state as Ruark, injured 8 months ago. Her imaging is cleaner. The asymmetry is sharper. I'm more confident about that one." "Send me her file." "Already in your inbox." She stayed in the conference room until 8:15, reading both files until she knew them the way she'd known her field protocols. Not memorized exactly, but internalized, so that the relevant details would surface when she needed them without having to reach. She made 2 pages of handwritten notes. She ate the rest of the granola bar from her pocket and drank a cup of coffee that the overnight staff had left in the small kitchen down the hall, and which had been sitting there long enough to qualify as a different substance than it started as. At 8:30, she went to the parking structure, drove home, set an alarm for 5 a.m., and was asleep before she finished the thought she was trying to complete. She dreamed about the FOB, not the bad version, not the night with the IED and the 3 casualties and the hours afterward that she didn't spend a lot of time thinking about consciously. The ordinary version, the smell of the air in the early morning before it got hot, the specific quality of light over the mountains, the sound of Dr. Olatunji's voice explaining the neurogenic assessment protocol the first time she'd seen it, his hands moving through the sequence with the patience of someone who had done a thing so many times it had become the clearest possible version of itself. "You're looking for the pathway," he'd said, "not the damage. The pathway is either open or it isn't. If it's open, everything else is just a question of access." She woke up at 4:53, 7 minutes before the alarm, the way she always did. Fell was outside Redstone Memorial's main entrance at 6:58 a.m. with a travel mug and a document folder, and an expression that said he'd been up since at least 5. He got in the passenger side without ceremony. "Rourke first," she said. "Agreed. The imaging asymmetry is more ambiguous on his case. I want to assess in person before we look at Okafors." He opened the document folder on his lap. "I spoke with Nambiar last night. She's prepared the patient space and she's reviewed the protocol description I sent her. She's concerned." "About the diagnosis or about what it means if she's right?" "Both. In that order, which tells me she's a good physician." He looked out the window at the early morning city going about its preliminary business. Delivery trucks, joggers, the specific thin light of a day that hadn't committed yet to what kind of day it was going to be. She was 3 years into her attending position when she evaluated Rourke. Good training, solid record. This isn't a case of someone cutting corners. "No," Emily agreed. "It's a case of someone not knowing what they were looking for, which is the problem we're trying to fix." They drove. The hospital was 90 minutes north of Ashbrook, a regional medical center in a mid-sized city called Farland that had the slightly tired quality of institutions that had been built for a larger population than currently used them. Nambiar met them in the lobby, early 40s, dark circles under her eyes that suggested last night had not been restful, a handshake that was firm in the specific way of someone managing anxiety through physical precision. "I've been looking at the scan since Dr. Osi called," she said, walking them toward neurology. "The T11 attenuation. I'm going to be honest with you. I see what you're describing. I didn't see it 14 months ago." She paused. "I don't know if that's because I wasn't trained for it or because I wasn't looking for it or both." "Both," Fell said, not unkindly. "A NVCS isn't in the standard differential for this presentation. You did a standard workup and arrived at a standard conclusion. The problem is the standard workup has a gap." "Has Tobias been told anything?" Emily asked. "No, he's been told we want to do a follow-up assessment. That's all." Nambiar stopped outside a door. "He's in there with his mother. She paused. "He joined the reserves at 19 because he wanted to pay for school. He's 22. He deferred his architecture program." She stopped talking. Emily looked at the door. "Let's see what we find," she said. Tobias Rourke was tall, even lying down, long-limbed, the kind of build that suggested he'd been athletic before the accident and had maintained the upper body of someone who used it to compensate. He had the careful watchfulness of a young man who had been subjected to many medical assessments and had learned to keep his expectations horizontal. His mother, seated beside him, had the specific exhaustion of 14 months of hope carefully managed down to a sustainable level. Her name was Claudette, and she'd brought a book she wasn't reading. Emily introduced herself. Fell introduced himself. Nambiar stood near the window. "We're going to run a specific assessment today," Emily said. "It's a protocol developed for military field medicine. It's not painful. You may feel pressure sensations, and we want you to tell us exactly what you experience. Everything you notice, even if it seems minor or you're not sure it's real. Tobias looked at her. What are you looking for? She held his eyes. We want to understand exactly what's happening with the neurological pathway. We're not assuming anything from your previous diagnosis. We're starting fresh. It wasn't a lie. It wasn't the whole truth either, but it was the version of the truth that was appropriate before the assessment, before they knew, before they had something definite to say. Okay, he said, simple as that. The assessment took 16 minutes because she went slower than she had with Sasha, more careful, more deliberate, partly because she had more time, and partly because the stakes of this one were different. With Sasha, she'd been working against dismissal and a ticking clock. Here, she had a room and a physician and the quiet of a morning that wasn't on fire. On the fourth sequence, Tobias said, Something's happening. She stopped. Describe it. It's like, he frowned at the ceiling, like pressure, down the outside of my left leg. He looked at her. Is that supposed to, which part of your leg? From, like, the knee down to the ankle. A pause. It kind of hurts. Claudette made a sound she immediately suppressed. Emily kept her hands where they were and kept her voice completely level. That's useful information. Thank you. I'm going to continue. 3 more sequences. Both feet. Directional responses in the L4 distribution pattern. Consistent, not spasm, not artifact. Pathway responses. The pathway was open. She took her hands away and stepped back. She looked at Fell, who had been monitoring and who looked back at her with the expression she'd seen on his face when he turned away from Sasha's scan in the imaging suite at Redstone Memorial. He nodded once. She looked at Tobias, then at Claudette. I want Dr. Nambiar and Dr. Fell to review the assessment record before we talk through what this means, she said carefully. That's going to take about 20 minutes. Can you wait? Tobias was still looking at his leg. I felt that, he said. Not to her. Not to anyone specifically. I know, Emily said. 20 minutes. In the hallway, Nambiar sat down on the bench across from the room and put both hands flat on her knees and looked at the floor. It's the same presentation, Fell said. I know. His prognosis. I know. She looked up. Her face had the complicated quality of a person receiving 2 pieces of information simultaneously, one that was good and one that was about her own role in the delay of it. We need to start a treatment protocol. Today, Fell confirmed, I'll need to co-authorize given the military medicine basis, but the underlying mechanism is the same as the vein case. The window is significantly more extended here, so 14 months is a long time, but ANVCS doesn't present with the same irreversibility timeline as true cord injury. The pathway being open suggests the compression is still at a stage that responds to intervention. He paused. The prognosis for full motor recovery is less certain than it was with Sasha, but there is a prognosis. There is one. Nambiar absorbed that. How do I tell him, she asked, not rhetorically, genuinely asking. Emily sat down beside her on the bench. You tell him what you found and what it means and what happens next, in that order. You don't explain your way around what happened before. If he asks, you answer directly. She paused. He's 22. He can handle the truth better than he can handle the version that's been managed. Nambiar looked at her for a moment. Do you always... She stopped. What? Talk like someone who's had to do this many times. Yes, Emily said simply. They told him together, Nambiar for the medical framework, Fell for the treatment specifics. Emily sat in the corner and didn't speak unless directly asked, which she was twice, once about the protocol, and once when Tobias looked at her and said, When did you know? When I saw your imaging last night, she said, and you came here today. Yes. He looked at the ceiling for a long time. His mother was holding his hand and not saying anything, which was the right call, and she seemed to know it. Finally, he said, Okay, what do we do first? Daphne Okafor's case, 2 hours south at a hospital called Westgate Regional, was faster, sharper imaging asymmetry, clearer presentation, 8 months rather than 14, and a clinical team that had already pulled the file and had 2 radiologists in the room when Emily and Fell arrived, which meant OC had done groundwork before they'd gotten there. The chief of medicine was a man named Dr. Harlan Voss, who was in his 60s and had the manner of someone who'd decided in advance to be cooperative and was working backward from that decision. The assessment took 12 minutes. Daphne's responses were bilateral and strong. Fell had his co-authorization signed before noon. They were on the highway back to Ashbrook by 12:40. Fell drove. Emily looked at the road and didn't talk for the first 20 minutes, and he didn't push it, which she appreciated. 3 down, she said finally. Holloway's 3 cases are being reviewed by the state medical board this week, Fell said. Osai has preliminary imaging access to 2 more from the pattern review. He shifted lanes. The numbers are going to keep moving for a while. How many do you think total? He was quiet for a moment. Honestly, I don't know. ANVCS isn't something anyone was looking for in civilian contexts before this week, which means it could be a contained cluster, or it could be a diagnostic gap that's been producing false permanence diagnoses for years. He paused. I think it's somewhere between those 2 things, and I think we won't know for 6 months. Emily looked out the window. The landscape between Farlin and Ashbrook was flat and agricultural, the kind that didn't ask anything of you, which she found useful right now. Tobias deferred his architecture program, she said. I know. He's going to need significant rehab. His timeline back to function is longer than Sasha's because of the 14 months. Yes. He might not get everything back. No, Fell agreed. He might not. The pathway is open. That doesn't mean 14 months of disuse doesn't have physical cost. His recovery is going to be real, and it's going to be hard, and it's not going to look like Sasha's. He said it evenly, without softening it. But he's going to have something he didn't have yesterday, which is a correct diagnosis and an actual chance. She thought about what Olatunji had said in the dream. The pathway is either open or it isn't. It's open, she said, mostly to herself. Yes, Fell said. It is. No. The formal public report from Army Medical Command and the Joint State Medical Board review was released 11 days later. Emily read it on her lunch break, sitting on the bench outside the neurology floor where she had eaten a granola bar and watched 2 news vans appear in the parking structure what felt like a different year ago. The report was thorough and its language was careful in the way of documents that had been reviewed by multiple legal teams before release, but the facts inside the careful language were plain enough. 5 confirmed ANVCS misdiagnoses across 4 civilian hospitals, including Sasha Vane's case at Redstone Memorial. 2 additional suspected cases under ongoing review. All 5 confirmed patients had been diagnosed with permanent spinal cord injury. None had received the correct diagnosis prior to Army Medical Command's intervention following the Vane case. The earliest dated back 4 years. Dr. Nathan Holloway's voluntary disclosure of 3 prior cases was noted in the report as a mitigating factor in the assessment of his conduct. His self-report had enabled earlier access to 2 of the 5 confirmed patients. The report was explicit about this. It was also explicit about the finding that his pattern of rapid diagnostic confirmation in ambiguous imaging cases represented a systematic failure that had extended across his tenure, and that his responses to clinical concerns raised by other staff, a record the board had reviewed which included not just Emily's case, but 2 prior incidents involving residents who had flagged alternative interpretations and been dismissed, constituted a professional conduct failure independent of the diagnostic error itself. His license to practice was under review by the state medical board. The Redstone Memorial employment termination was confirmed permanent. The cases he'd disclosed were being managed with their patients' informed participation. There was a section on the knowledge transfer gap between military and civilian medicine regarding ANVCS. It recommended formal cross-training protocols, updates to the civilian neurology residency curriculum, and the development of a standardized screening tool for high-impact trauma cases in patients with military background. The Landover Singh paper was cited 4 times. Emily's field assessment protocol was documented, attributed to Dr. Olatunji's original development and Emily's applied adaptation, and recommended for inclusion in the proposed screening tools methodology. She read that section twice. Her name was in a federal medical report, not as the subject of a misconduct review, as a source. She put the report away and finished her lunch. Sasha Vane's first full weight-bearing walk happened on a Tuesday, 23 days after her admission. Emily wasn't supposed to be there. She was on floor duty, and the rehab unit was 3 floors down, and there was no clinical reason for her to leave the neurology floor at 2 in the afternoon on a Tuesday. She went anyway, because Denise looked at the clock and looked at her and said, "I've got the floor for 30 minutes," without being asked. The rehab unit at Redstone had large windows on the south side that let in whatever sun the afternoon had available. The space smelled like effort, clean effort, nothing antiseptic about it, just the human version of working hard in an enclosed room. There were 2 other patients working with their therapists when Emily arrived, and Torres was at the far end of the parallel bars, and Sasha was at the near end. General Vane was standing against the wall, not sitting. She'd been standing against walls in this hospital for almost a month now, and had gotten no less formidable for the familiarity of it. She saw Emily come in and nodded. Emily took a position a few feet away from her and watched. Sasha's hands were on the bars. Her feet were flat on the floor, both of them, flat and present and bearing weight, which was still something Emily had to let herself absorb each time rather than taking it as given. Her jaw was set in the way it was set when she was doing something difficult and not planning to show how difficult it was. Torres said, "Whenever you're ready." Sasha took 1 step, then another. She made it 6 steps down the length of the bars before her left leg shook, and she tightened her grip and stopped, breathing, not falling, just stopping. "That's good," Torres said. "I didn't fall," she said. "That's what good means." She stood there for a moment in the middle of the bars, in the middle of the room, weight on her own feet. She looked up and found her mother first, the instinct of it, years of it, and then her eyes moved and found Emily. She didn't say anything. Neither did Emily. There wasn't a version of language that was the right size for the moment, so they let the moment be itself. 3 weeks after that, the hospital held a formal review conclusion event. Not a celebration exactly, the lawyers had been clear about the language, but a structured acknowledgement meeting that included the board, Army Medical Command representatives, the Medical Executive Committee, and the relevant staff. These things were usually small and procedural. This one had 40 people in it, which was not small, and several of them were in uniform. Emily sat in the second row because she'd arrived before the front row filled, and then people she recognized kept taking the chairs around her until she was in the middle of something she hadn't planned for. Hartley spoke first, the board's formal language about institutional learning and process improvement and commitment to cross-disciplinary integration. Then Drayden spoke about the Army Medical Command investigation and its findings and the training protocol updates and development. Then UN presented the joint report's recommendations and the timeline for implementing the ANVCS screening tool. Then Hartley said, "I'd like to formally note for the record that Emily Carter's reinstatement to the nursing staff of Redstone Memorial is permanent, with a personnel record that reflects her conduct in this case as exemplary. Effective this week, she is being appointed as clinical coordinator for the hospital's new Military-Civilian Medicine Integration Initiative, a role that will involve training, protocol development, and case consultation in the area of military-specific trauma presentations." Emily had known this was coming, Hartley had told her the day before, and she had still not entirely prepared for the experience of sitting in a room and hearing it said out loud. Drayden stood up next. He was holding something, a small case, the kind she recognized from military ceremony contexts, which she had not expected to see in this room. Army Medical Command wanted to formally recognize Nurse Carter's contribution to this case and its broader implications. The identification of the ANVCS pattern, the clinical assessment under significant institutional pressure, and the subsequent contribution to both the immediate patient outcomes and the ongoing investigation, these represent the application of military medical training in exactly the context it was developed to serve. He paused. This commendation is issued by Army Medical Command and co-signed by the Surgeon General's Office. It recognizes Emily Carter's extraordinary contribution to patient care, institutional accountability, and the advancement of military-civilian medical knowledge transfer. He handed her the case. She took it. She didn't open it in the room because she couldn't quite trust what her face would do. And she had spent the better part of the last month being careful about what she showed in rooms that had too many people watching. People were clapping. She was aware of that. She was also aware of General Vane in the third row, clapping without theatrics, which was the appropriate version. She was aware of Fell against the wall, arms crossed, with the expression of someone who was not surprised by any of this, but was satisfied in a way he wasn't going to perform. She was aware of Denise in the back of the room, who caught her eye and gave her the small nod that meant "I told you so" without any specific content of what exactly she'd told her, which was its own form of warmth. She was aware, somewhere in the recognition of all of it, that the room was full of people who had varying roles in how the last month had gone. Some of them had helped, some had stayed neutral, some had been in Holloway's corner until the corner stopped being viable. Institutions were not good or bad. They were composed of people making choices under conditions, and the choices accreted into outcomes, and the outcomes became the record. The record now included her name in the column she wanted it in. She found Sasha in the rehab unit the next morning, which had become a kind of routine. Emily stopping by before her shift formally started, sometimes 5 minutes, sometimes 15, watching Torres put Sasha through progressions that had advanced significantly since the parallel bars. Today, Sasha was walking without the bars. Slow, deliberate, a slight asymmetry in the left step that Torres said would reduce over time and might not disappear entirely, which Sasha had received with a flat nod that said she'd already made her peace with the might not. She saw Emily come in and kept walking. "Torres says I can try stairs next week," she said. "That's fast. He says I'm annoyingly motivated." She stopped at the end of the room and turned around, which she did with the care of someone who had learned not to trust turning yet. "Is that bad?" "Probably not." Sasha walked back, stopped in front of her. She was eye level with Emily now, which she hadn't been from a hospital bed. "I got my reinstatement letter for the academy," she said. "I deferred, not withdrew. They're holding my place." Emily looked at her. "Are you going back?" "Eventually." She looked at her feet, then up. "Not this semester. Maybe next year. Torres says full return to physical standard is a realistic goal, but the timeline is..." She shrugged. "Long." "Yeah. I'm not..." She stopped. Started again. "I used to think the worst thing that could happen was not being able to do the thing I trained to do. And then the worst thing happened, and I thought it was permanent, and Another stop. She was 17, and she was working through something in real time, in front of another person, which took a specific kind of courage that wasn't military and wasn't trained. "I'm different now. I don't know if that's bad." "It's not bad," Emily said. "It's just true." Sasha looked at her for a moment. "Were you different after your deployments?" "Yes." "Was it bad?" Emily thought about it honestly, which the question deserved, about the things she'd carried back and the things she'd left behind, and the version of herself that existed on the other side of the FOB and the medevac and the years of it, about whether the version she was now was better or worse than the version she'd been before, and whether that was even the right frame. "Some of it was bad," she said. "Some of it made me better at things that mattered. Most of it was just what happened." She paused. "You use what you can use and you carry what you can't put down, and after a while you stop sorting it, and it's just you." Sasha absorbed that in the quiet way she absorbed things. "Okay," she said. And then, because she was 17 and because she had walked the length of a rehab room on her own feet and had an academy letter waiting and a future that had been given back to her by someone who refused to stay quiet. "Thank you. I mean it. I know I keep saying it." "You can keep saying it," Emily said. Sanat. The commendation case sat on her kitchen table for 4 days before she opened it, not because she was avoiding it, because she kept arriving home late and tired and intending to open it, and instead making tea and sitting down, and the case would be there on the table, and she'd look at it and think tomorrow, and then it would be tomorrow. On the 4th day, she opened it. Inside, a formal commendation document, the language precise and specific, citing the Vane case by record number and her contribution by action. Below the text, two signatures, Drayden's and the Surgeon General's office countersignature. And below that, a handwritten line in the margin that wasn't part of the official document and wasn't signed but was in Fell's handwriting, which she recognized from the documents he'd annotated in the conference room. Olatunji trained you well. Use it. She looked at that for a moment. She thought about Dr. Olatunji, somewhere. Retired, she thought, somewhere in the southeast. She'd lost track exactly. His hands moving through the assessment sequence with the patience of perfect repetition. You're looking for the pathway. She thought about the morning in the FOB when she'd used it for the first time, terrified and certain at the same time, and the private named Dennis, who walked out of the medevac transport on his own feet 6 weeks later. She thought about what it meant to carry something. Knowledge, technique, the specific shape of having seen a thing and knowing what it was, across years and deployments, and a transition back to civilian life, and 16 months of ordinary nursing work on an ordinary floor. Carrying it without knowing when you'd need it, without knowing if you'd need it, without ceremony, and then needing it. She closed the case, set it back on the table, made more tea. The ANVCS screening tool was completed for 14 weeks after the vein case. Emily contributed to the clinical methodology section, working with OSE and 2 Army Medical Research Institute researchers over 6 weeks of video calls and document iterations. The tool was not elegant. It was a structured checklist with branching criteria, the kind of thing that would be used by a physician in a room with imaging on a screen, guiding them to look specifically at the indicators that ANVCS produced and that standard civilian training hadn't prepared them to see. It included a version of the modified neurogenic assessment protocol, adapted for civilian clinical settings with physician authorization requirements. The protocol was attributed to Dr. Olatunji's original development and documented as clinically validated through its application in 5 confirmed ANVCS cases. The tool was approved for distribution to civilian hospitals with significant military patient populations. Implementation was voluntary, but Army Medical Command was making it a required element of any facility seeking to maintain military-affiliated patient designation. Nambiar at Farland Regional was the first outside physician to request the full training package. She did it before the distribution was even complete, which OSE told Emily on a call where OSE was clearly trying not to sound as satisfied as she was. Tobias Ruark's first documented voluntary movement following treatment initiation came at week 3 of his protocol, slower than Sasha, consistent with the extended compression timeline, but the pathway doing what open pathways did when given the right conditions. Daphne Okafor, 8 months in instead of 14, walked out of Westgate Regional's rehab unit under her own power 41 days after her treatment began. Fell sent Emily a photo from OSE, who had been there for the assessment follow-up. It was blurry the way phone photos taken in hallways were blurry, just the shape of a young woman upright and moving, but the shape was enough. Holloway's license review concluded 6 months after the vein case. The state medical board found that his pattern of dismissing clinical input from non-physician staff represented a systematic professional conduct failure, distinct from and compounding the diagnostic error. His license was suspended for 18 months, with reinstatement conditional on completion of a supervised clinical review program and mandatory training in collaborative diagnostic practice. He would not practice as a department chief again. That finding was permanent. He did not contest the suspension. His attorney filed no appeal. Emily heard about it from Arden, not from any public source, and she sat with the news for a moment and thought about the rooftop, about his hands not entirely steady. I decided too quickly. The suspension was appropriate. She didn't feel good about it, exactly. There was no version of appropriate consequence that felt like winning, because winning implied the thing hadn't happened, and it had happened. There were people whose lives had spent time inside a wrong answer. That didn't go away because the answer was corrected. What went away was the silence around it. But on a Friday in late spring, 3 months and 11 days after the morning, Emily Carter had arrived 12 minutes early to a shift she'd thought would be ordinary. She sat in the on-call room between cases and called her sister. Her sister answered on the second ring, the way she always did, because her sister treated the phone as a device that existed to be answered and had never understood why everyone else treated it as optional. "How are you actually?" her sister said. Not hello, just the direct version, which was the only version her sister had. "Tired," Emily said. "Good. Both. I read the thing in the medical journal about the screening tool." "Yeah. They spelled your name right." "They did." Her sister was quiet for a moment. "Mom would have—" She stopped. Their mother had been gone for 4 years, a fact that was present in every family conversation without needing to be stated. She would have had opinions about all of it. "Loudly," Emily agreed. They talked for 22 minutes, real talking, the kind that had nothing to do with hospitals or protocols or the shape of the last several months. About their sister's kids, about a trip she was planning, about a book they'd both read years ago that had come up in a podcast and whether it held up. About nothing. About everything that was not the thing Emily had been carrying. When she hung up, she sat in the on-call room for a minute in the particular quiet of a hospital between events. She thought about what she would tell someone if someone asked her what the last several months had meant. Not the official version, not the language of the commendation or the medical board report or the journal article. The actual version. She thought about the briefing room, the way the room had gone quiet, the way she'd said something anyway and watched the ceiling of the world she operated in close down around her in the space of an hour, badge in a plastic bin, form on a desk, the specific smallness of being reduced to a category rather than a person. She thought about Sasha's foot moving. She thought about 14 months of Tobias Ruark building a life inside a wrong answer, and the specific quality of his face when he said, "I felt that." Not hope, not yet, just the raw surprise of a pathway opening that he'd been told was closed. She thought about what it cost to say something when the room was not on your side, not the dramatic version, not courage as a concept, not the word as it appeared in commendations and citations. The actual version, which was smaller and more specific. The cost was the risk that you were wrong, and the cost was the certainty that whether you were right or wrong, saying it would change your relationship to the room. Both of those costs were real. She had paid them without knowing for certain they were worth it, because certainty wasn't available in advance. You paid, and then you found out. She thought about the people she knew who had not said something, not because they were cowards, and not because they didn't see it, but because the calculation had gone differently in their particular room on their particular day, and the risk had seemed too large and the ground had seemed too uncertain. She didn't judge that. She understood it. What she knew, sitting in the on-call room on a Friday afternoon, was that the version of herself who had said something anyway, who had sat across from General Vane and said, "I need your permission," without knowing if she was right, was the version of herself that she could live in, not comfortably, not perfectly, not without cost, but fully. With the specific completeness of someone who had used what they had when it was needed and had not saved it for a more convenient time. That was the whole lesson. She didn't have a more elegant version of it. Her pager buzzed. A case on 3. She clipped it to her pocket, stood up, and opened the door. The floor was in front of her, ordinary and relentless and full of people who were having the worst days of their lives and needed someone in the room who would look at what was actually there rather than what was easiest to see. She walked out to meet it. The people who told you to stay quiet were counting on something specific, that the cost of speaking would feel larger than the cost of silence. They were often right. The cost of speaking is real, immediate, and personal. The cost of silence is diffuse, delayed, and paid by someone else. Sasha Vane walked on her own feet. Tobias Ruark felt his leg for the first time in 14 months. Daphne Okafor walked out of a hospital and didn't look back. They got those things because someone was in the room who had seen it before and said so, even when the room made clear that saying so was not welcome. You don't have to be a nurse. You don't have to have 3 tours and a field protocol and a commendation in a case on your kitchen table. You just have to know what you're looking at and be willing to say it out loud. That's it. That's the whole thing. Say it.